My name is Natalie. I'm with the Iowa Donor Network. I'm a professional outreach coordinator here to do your annual education. So I've been here the past couple of years. The faces you'll see along our presentation today are what we call faces of donation. So they are either recipients here in Iowa or donor families here in Iowa. Some of their stories I can tell you, I know this gal right here, she was in high school, she had to receive a heart transplant, and she received it on Valentine's Day 4 years ago. So pretty cool how that worked out. So you have all recipients here across the screen. Some objectives we'll be covering, I don't have to read each and every one, but these are just some things that we'll be covering, stuff like donation facts, our follow-up after donation, what your guys' role in the donation process is, and just some important things throughout about the procedures for donation. I'm going to start you guys off with a video.
My absolute most important job in the Army was a 4-month stint that I had as a CNO, which is a Casualty Notification Officer.
The hardest part of doing a casualty notification is knowing that you're delivering the worst possible news to someone.
You can't fail on that mission. That family's only going to receive that news one time. You only get one shot.
There is no right way to tell somebody that their family member died, but there's a lot of wrong ways, and it does affect you. It's tough.
A little anxious, but not the same anxiety I would have had back in the Army. More like excitement. Cecilia upstairs. Hi, Cecilia. And I used to command a unit in the Army that did casualty notifications to next of kin.
My name is Don Puka. I used to be a casualty notification officer for the United States Marine Corps.
I was tasked with the responsibility of telling loved ones that their family members weren't going to return home.
I'm here today to deliver a different kind of news.
In this case, I think it'd be best if you read this.
Gracias aún con dolor.
We found the organ for the transplant we have been waiting for.
Thanks to selfless of an organ donor.
Who said yes to the gift of life. We found the organ I've been waiting for.
You know how hard it is, how hard the wait has been.
We wish that the schools play we hope it happens. That's when this battle. Oh my God.
The best news is I'm gonna have. I'm happy for the children was number one with me. Thank you.
It's okay to cry. Let's see,
Okay?
Today. Right now.
Sort of validates how precious life is. I wish I could do this every day.
And the smile come across his face felt so good. Just amazing. It was awesome.
It was a great experience today. It was really nice to actually give good news to somebody and see their reaction.
Many people in the U.S. need transplants. In fact, all over the world they do, and there aren't enough donors to go around.
They may have waited 12 to sometimes 15 years to get a transplant.
Giving your organs when you leave is probably among the most noble acts you can do to actually save somebody else's life.
It benefits all of us.
Before today I was not an organ donor. I will be an organ donor by the end of the day.
I just like to share that video because it shows you the impact that donation and these gifts have on the recipients who get these gifts, their excitement, what they feel. But also know too, some of our recipients actually choose not to receive a transplant, and the reason they do that is because they feel guilty of receiving a gift from someone who's passed away. So we do have that side of things. It doesn't happen a lot, but it can happen, and they go through a grieving process just like our donor families do. Not the same, but they do go through a grieving process because of the guilt that they may be feeling along with that. But it just goes to show you the impact that we can have on someone else's life if something were to happen to us. Our mission is working together to transform lives through organ and tissue donation. Through that, all inspired to donate life. The faces you see along the bottom there are donor families here in Iowa. The couple closest side to me, they lost their 10-year-old son Garrett in a tragic accident at their home. He was later declared brain dead at the University of Iowa, and the family was given the option for organ and tissue donation. They did decide to move through with it, and Garrett was able to save 5 lives through his organs, restore vision for 2, and enhance several hundred people's lives through tissue. Even though they greatly miss Garrett, they grieve all the time. Obviously, I would never take that away. But in the statement that they made to us and wrote up was that offered a little light during such a dark time. And if they weren't able to keep their son, they might as well help somebody else who doesn't have to go through that grieving process. So a pretty positive outlook that they can, again, look at it, and that's just another way to look at donation. It may be a dark time in your life, but it's a little bit of bright light during such a dark time. The gal on the other side of the screen lost her 2-year-old son due to complications of a tonsillectomy. So something we see as a pretty common procedure. Went home later that night, something happened, got sent back to the hospital, was air carried down to the University of Iowa, where again he was under pronounced brain dead. The family was given the option for him to be a donor. His mom decided and dad decided for him to be a donor. He actually donated then on his 3rd birthday. So his mom wanted, he was close enough to that, so we made that happen for them. So just a little bit before, or right after midnight on his 3rd birthday, he was able to be a donor and give those gifts. So again, she looks at it the same way. She's still very much so grieving. She has 6 other children since has had a baby, but it's very difficult for them as well. But again, something I'm able to offer them a little bit of hope during that time. We are a not-for-profit organ procurement organization, tissue recovery agency. As an organ procurement organization, we are regulated by CMS, or Centers for Medicare and Medicaid. And as a tissue recovery agency, we're regulated by the FDA. So any of you that have donated blood or plasma in the past, the questionnaire that we are mandated to fill out or we can't donate is the same exact questionnaire that we go over with our families. So if any of you have had any experience with donation or filling out that medical social history, that is a mandation of the FDA. We have to follow that to a T. It can be a pretty lengthy process, and unfortunately we do have to do this within several hours after the time of death because we have to do tissue donation within 24 hours. So it's a pretty sad time that we are dealing with families, but those that decide to go through with it are happy in the end. It can take up to an hour to do the paperwork. We're asking a lot of in-depth questions, but just know that that is for the safety of our recipients, the staff, and really for anybody involved. So we would never want to recover anything that could possibly be contaminated with something that could transfer to somebody else. We have offices in North Liberty and Altoona. We've got a communication center that operates 24/7, 365. So anytime you make that referral call, there's always someone there to answer your call at that time. We've got 2 dedicated tissue recovery suite locations. So we've got recovery suites in North Liberty and Altoona. Up until about 8 years ago, we always came to the hospital to do tissue donation. I don't know if any of you remember that or not. But we have to go all over the state to try and fulfill all those donors who wanted to donate tissue at that time. But because of that, we had to tell a lot of families no, because we'd have to go to Sioux City, to Keokuk, to Decorah, Mason City, all over the place, right? So currently this year, we've had about 930 tissue donors. So if you can imagine that many, I mean, it would not be possible to fulfill that many. So since we have locations now in North Liberty and Altoona, we're able to tell everybody yes that wants to do it. So we don't have to turn anybody down for tissue donation. We also still have off-site recovery capabilities, meaning that if there's someone here at the hospital that passes away, that the only reason they wouldn't want donations is because they don't want their loved one moved. We can work with the hospital, so we can work with you guys to make sure tissue donation happens, and we come here to your hospital just like we used to. If there's an OR available for us, we'll bring our staff, our supplies, and that can happen that way as well. We can also recover at the State Medical Examiner's Office in Ankeny and at the University of Iowa Hospital and Clinics in the Decedent Care Center. So anyone that may need an autopsy, so any... Oh no!
That would totally be.
So in any situation that someone may need an autopsy, It does not rule them out for donation. So even in a homicide situation or a suicide, does not mean that they can't be donors. It would really then become up to the pathologist at both those locations. All those pathologists are very, very pro-donation, and they are going to do everything in their will power to make sure that person is a donor if their family wants. So we do have those capabilities as well. We also partner with the Iowa Alliance iBank, so we work very closely with them. When you guys make that initial referral call to us, you're actually also calling for eye donation as well. You may not know it, but we screen right up front for you. So that way you don't have to call us and then call them. The only time you ever have direct communication with them is if we have to step out of a tissue case, we can't do tissue. Then they would be in contact with you to organize cornea, because then they would come up to the hospital to recover corneas. But when it's a tissue cornea, they recover at the recovery suite with us for tissue. So that's how that happens.
I have a question.
Yeah.
Sorry,
No.
I'm a little lost. So if Mercy Hospital has someone on a ventilator and they are pronounced brain dead but want to do tissue, organ, and all that donation, they usually go down, they take the patient down to the OR.
That's for organ, I'm sorry, talking about tissue.
Okay.
Yep, so organ donation would still happen at the hospital, and then tissue, they'd be transplanted
They would be transported.
to one of our recovery suites. Either that, or they would be recovered in the recovery suite, either in the university or at the state medical examiner's office. So that's good. Organ recovery always takes place in a hospital setting, because they have to be on ventilated care for that to happen.
Okay.
But once organ donation has taken place, then comes tissue, and then they would be transported to either the tissue recovery suite if there's no autopsy, or right there at the university, down there, recovery suite.
Recovery suite in Mason City then?
In Mason City, no, but they could be transported to North Every, or we would do tissue recovery right under there, or it just depends on the situation. So, yep, good question. So a little bit about legislation. The first person consent legalized the transplantation of human organs and tissues. So basically what this does is protect all of our registered donors from a family coming and saying, no, I do not want them to be a donor. Because we are the organ procurement organization here in Iowa, or any organ procurement organization across the United States, when someone is a registered donor, we have to fulfill that wish. So if the family comes back and says, nope, I don't want to do it, it is a legal documentation, and so we have the right to move forward with donation without witness consent to do so. It's just like any other DNR order, end of life wish, we have to follow that, we can't vary from that, and that's the same thing with organ and tissue donation. So that's what that act was put into place for.
But that's not just saying yes on your driver's license, that's going and filling out.
No, that's saying yes on your driver's license, that's your legal documentation.
That happened
I'm done eating, but they're
just
still eating.
like
so I
within the
don't
last
know
week,
what's
the patient was yes on his
Mm-hmm.
card, on his license, but his family refused.
So, tissue and organ work differently. Organ, we can continue to move through without consent because you can do all the medical testing in the hospital. Tissue donation, we have to have the medical social history from the family. If the family refuses, then we're stuck because we can't move forward with a tissue donor if we don't have a background because of the unsafeness or not knowing what they have. So it does happen. But, and I'll go through our or kind of a procedure change here. Anybody specifically who is a registered donor, we are gonna 100% always contact the family. Even if they tell you no, that they don't wanna talk to us, because their loved one is a registered donor, that is our duty to make sure we at least talk to them and let them know that their loved one is a registered donor and that we need to try and follow their wishes for that. If they still refuse to do paperwork with us, we have to step out, unfortunately. It doesn't happen that often, but I did notice that you guys had a case here not that long ago.
Yeah.
That he was a registered donor, but the family refused to speak with us.
Yes.
So that can happen, but organ donation works differently. We can still move forward with organ donation. Do we that often? No, because by the time we're able to talk with the family face to face, they usually make a decision for them to be donors. So, yeah. And we are Centers for Medicare and Medicaid Services, or CMS, requires that all CMS-funded hospitals refer in all cardiac and image deaths to the OPO. So every single hospital in the United States has to make a referral call. That's just a mandation. You guys get hospital reports every year stating that you have or have not made those phone calls. None of my hospitals have ever not made a phone call, but I know hospitals that have, it's not a great thing to, state surveyors and stuff will come in and see that. We mandates that only trained personnel discuss opportunity of donation with potential donor families. So we have trained personnel that talk with their families that are very good, that have a social work background. So we want to put that on them to explain the situation. That is why we don't have you guys discuss donation opportunity with the family, because you guys aren't trained to do so. And then we have all the information we can give them as far as what can be donated, how is it done, the process, how long is it going to take, that sort of thing. So it takes an uncomfortable conversation off your plate. We are HIPAA exempt to allow healthcare professionals to disclose protected patient information to the OPOs. So before, when we'd have you fax us the chart, we wouldn't have to have a release form signed. But now that we have access electronically, basically what we do is just sign in and pull up that patient's chart. And again, we are HIPAA exempt. So this falls for any run reports that EMS may need to send. So if any of you are involved in EMS or maybe an MEI, you can also send us an MEI or one report as well. And we have to have all that information. If we have an agency that refuses to send us that, we will have to call the family back at a later time and tell them, yes, your loved one was recovered, but we had to get rid of all their tissues and throw it away because so-and-so refused to send us paperwork. So unfortunately, if we can't get that, which it doesn't happen that often, but I did have one small town EMS agency that even though I sent them the HIPAA disclosure, they still refused to send us paperwork. So 6 months later, we had to call the family and let them know that loved one's tissues couldn't be used. So that can be very unfortunate as well. So it's just important that you guys really don't, you send us everything we have. We don't have issues with it in the hospital. It's more out of hospital. So again, for any of you that may be MEIs or work in the EMS field, that's something to think about if you're out in that field. How do you register? There's 3 ways in which you can register to be a donor. You can send a pamphlet, you can go online, or you can do your driver's license. You only need to register one of those ways. Obviously, the most common is through your driver's license. So if you are a registered donor, on the bottom left side of, or my left side of that, of the driver's license, it'll say donor and a double Y. So that means you are registered. If you are not registered, it'll just be blank. We don't have a legal no here in Iowa unless you get it notarized on some sort of will or anything like that. So you're either not registered or you are registered. So not registered could mean that you still want to be a donor, but you just didn't get registered. Could mean a number of things. So we are an opt-in state, meaning everybody's not a registered donor unless they specify otherwise. There are some states that are opt-out, and many, many countries, in fact, most countries are opt-out, meaning that everybody is a registered donor unless they specify otherwise. So I hope we go to that someday, just because we do see the need of the amount of recipients waiting, and we have so many people passing away that we don't have enough donors to go around. Good thing, here in Iowa, we actually have 70% of our total population is registered donors. So it's very, very good, and we continue to see that increase. I think we went from 65% last year to 70% this year. So that's a positive. Anyone of any age can donate. Anyone want to take a guess as to how old our oldest donor has been in the past, tissue donor?
102.
Okay, good guess. 104 has been our oldest tissue donor. And they were able to donate skin. So we never defer because of age. Age is taken in consideration with what can be donated. So if that one tissue for some reason cannot be donated, we'd have to defer the case. We never defer because of age. Organ donation is the same way. We will take every referral call, even if there's a 95-year-old patient on a ventilator. We will screen for possible organ donation opportunities. If there is an opportunity, they can be a donor. I think our oldest organ donor has been 80. So we never rule out anything specifically for age. And we can actually donate as low as 37 weeks gestational as well. We don't take skin, we don't take bone, but we do take a little heart for heart valves. And there's a great need for this and a wait list for this in our pediatric kiddos with congenital heart defects. So that's what would be taken out of a young kiddo. A patient's income, race, or social status are never taken into account when determining one's place on the wait list. So if anybody of you know anything about transplant or have that experience, there's multiple factors that are taken into consideration when someone is on the wait list. Location is big, size is big, compliance. If you're not taking your medication or you're drinking when you're not supposed to be or something along those lines, you will be taken off the wait list and not put back on until you can show that you're compliant. I used to work in kidney dialysis, and so compliancy was huge, and we had to document and all that. And we had several patients that were taken off the wait list almost forever because they would come in 10, 15 pounds over what they're supposed to be of their weight, because they would take in that much fluid, and we just cannot get that off. And so what that's telling the doctors is who's to say that they will take care of their kidney if they get a transplant. So compliancy is huge. Age can matter as far as who's getting it. So like a pediatric donor would not be able to give their heart to an adult unless it's a really small adult that may be able to receive that, but typically an adult heart goes to an adult recipient, that sort of thing. The first priority of a medical professional is to save lives when someone is sick or injured. You guys are well aware of this. That's the first thing you're going to do is try and save their life. However, we have a lot of kids out there or adults that have heard somewhere along the line that if someone sees yes on their driver's license, they're going to let you die and take their organs. Sounds silly, but every single driver that I go to, which is multiple a year, I have at least 1 to 2 kids raise their hand and say they are not registered for that reason because they've seen it in a false article on Facebook or on some medical show that does not have accurate information. So just make sure if you have kids, parents, aunts, uncles, spouses, whatever that think that, make sure you correct them and let them know that obviously we're going to do what you can to save their life first. There's no cost associated with donation, never pass on the donor and their family, so another big myth out there. Many, many reasons why people don't even want to talk to us up front. So this is one of the things we will discuss with them when we get them on the phone, that you're not going to get a bill in the mail. And I get that. They have to pay for a funeral now, they have medical expenses, who knows how long they've been in the hospital, maybe they have a air care expense, all that stuff adds up. So we never charge for donation, any part of it whatsoever. So if someone's an organ donor, from the time they sign that paperwork, if they're in the hospital 3 more days, we take care of those 3 days of charges once they sign the paperwork. So we don't leading up to it, but once they authorize they want donation, all hospital expenses are covered after that. So again, no cost with that whatsoever. There's an open casket viewing. An open casket or viewing is possible with organ and tissue donation as well. Another big fear of a lot of individuals, they want to be able to have that closure. You would never be able to tell a donor next to a non-donor. Everything we do is with utmost respect and dignity, and all donation or recovery is unlike any other surgical procedure would be done. So the organ wait list, as of November 1st, 2017, anyone want to take a guess as to how many people are waiting across the United States for their organ?
400,000?
Yes, that's a good guess. Anybody else? So 116,500, but it feels like 400,000 people because it may seem like a smaller number than 400,000, but when you compare to the transplants we have per year, it's very large. We can't even begin to transplant even half those people on that wait list. Here in Iowa alone, we have 714, and that just includes the people on our transplant center's wait list. So that could include someone that lives in Wisconsin and is in Iowa, or maybe someone that's in Iowa but is not on the Iowa wait list. They would not be counted in that number. So it's just people on our transplant center wait list. But for Iowa, that's a pretty large number for the small amount of people we have in our state. Those of you that are visual people, if you take Jack Trice Stadium and Kinnick Stadium and take all those people that are sitting in those and combine that, that is the wait room that shows you how many people are waiting across the United States for an organ. So you can't even pick out faces in that. So it's pretty incredible, the impact. 20 people die each day while waiting for a life-saving gift. So every 24 hours we're sitting here or we're alive, we have 20 people passing away because they didn't get that transplant. And every 10 minutes there's another name added to that transplant waiting list. So in the 50 minutes I'm going to be here, we have 5 people added to that wait list. So pretty large numbers of people. So you take that 116,500 people waiting, we only perform 33,600 transplants a year. And that's not because we have a shortage of staff or we can't do it, it's because we do not have enough donors to donate to those recipients, or to those people waiting. So as you can see, it doesn't even begin to cut down our wait list. So people that have or get the news that they have to go on a wait list, it's pretty terrifying because there's never reversing anything now with their organ is failing until they get a transplant. So either people are on dialysis for many years, like the guy in the video, he was on dialysis for 14 or 16 years before he ever got a kidney. I have an uncle that's been waiting for kidney and pancreas for 3 years now. He's got 2 young daughters in college, and none of his family is a match. So no one could be a living donor to him if they wanted to in his family. So he has to wait for a deceased donor, and unfortunately that's a lot of people. So living donation is an option, but unless you have matches that are willing to donate, it won't happen. So it's pretty rare for someone to get a living organ. 47,000 corneal transplants are done every year. There's no wait list in the United States for that. However, in other countries, there is a wait list. There's a small country down in Africa that we have a doctor, I think based out of Iowa City, that has gone down there the last 2 years, brought corneas with him, and been able to transplant several people in that area. For some reason, they have a very high population of people needing cornea transplants. And he's going to go down again yet this year, next year to do that. So it's pretty cool. So all of our tissues can go internationally if our family consents to do so. And then we see 1 million+ tissue transplants every year, and that's a lot of tissue that you can think of. Most orthopedic surgeries use some sort of cadaver, which is also donor tissue, skin, breast reconstructive surgery. We have a lot of surgeries that use donor tissue. In 2016, 55 Iowans shared the gift of life through organ donation, and through those 55 people, 171 organs were transplanted. So as you can see, one person makes a huge impact on multiple people. So it may seem like a small number, but if you break it down, we see about 30,000 deaths in Iowa every year. Out of 30,000 deaths, only 2% of those people are going to die as a result of brain death, which will give them the opportunity for donation. And then out of that 2%, not all of those people are candidates for donation. So it's very, very rare to be an organ donor, if that makes sense. So the less people we have registered, that's the less people that we're going to have to donate. So the more we have registered, the better. On average, 92 transplants take place per day in the United States. It would take over 3 years to transplant each and every person waiting. That's without adding another name, but we'd still have 20 people die every day waiting for that. So the impact, we can save the lives up to 8 people through organ donation, enhance the lives of more than 300 people through tissue donation alone. So just think of the impact or the lasting impression that you're making when it's our time to leave, because I think that's pretty incredible. As far as I'm concerned, there's nothing good that my organs are going to do for me when I'm 6 feet in the ground. So that's the way I look at it. It's not how everybody looks at it, and that's okay. But just truly think about that and the impact, or maybe you might have a loved one, hopefully not, but if you already have or you may, that could impact this as well. But also think about it from your standpoint. When you are making that referral call, no, you're not making it for someone who can be an organ donor, because you're not going to have organ donation here in your hospital. You may stabilize someone to be flown out to critical or higher critical care. But the referral calls you are making, if that person does go on to be a donor, you're possibly enhancing 300 people's lives alone with that one donor. So it is an impactful phone call that you're making, and we thank you for that. Donation starts with one but requires many. So we could have, like I said, 70% of Iowans are registered donors. That's great. That's really great. But fact is, only a third of those 70% of people are going to die in the hospital. The rest are going to die out of the hospital. Out-of-hospital agencies are not required at any point in time to make a referral call. If they don't like Iowa Donor Network or they don't like donation, they can choose just not to make that phone call. Or if they don't know, they just don't make the phone call. Hospitals are required to call in every single death, so at least if you die in a hospital, you will be given every chance possible for your loved one or yourself to be a donor. But if you die in a hospice facility, or at home with hospice, or in a nursing home, or in a tragic car accident, something along those lines, none of those healthcare professionals, so no funeral directors, MEIs, paramedics, police officers, nurses that work in nursing homes or hospice are required to ever make that phone call. So that means that it's a 50-50 chance if we die out of a hospital whether we're going to be a donor or not. Pretty sad. I have a lot of questions, well, why can't they be mandated? Because hospitals are regulated by CMS, that's a CMS mandation. So that's pretty easy, we can make all hospitals do that. Out-of-hospital agencies, they're all regulated by somebody different. So right now, it's not a possibility to get them mandated and make that call. So again, if you are someone or know somebody that works outside of a hospital setting, it is very important to bring this back to your agency. We do education for out-of-hospital agencies as well, so I'd be more than happy to come and talk. We have finally increased from about 15% of all referral calls being out-of-hospital agencies to 30% this last year. So it's increasing, but there's still a lot of work.
So even if you're in a car accident, like the EMS or the medical examiner, if it says it on your card, they don't have to make that phone call?
A lot of times they don't even pay attention to it.
That's too bad.
It is. I'm not saying they all don't. Some are very, very good. There are some agencies that make every referral call every death, every time.
I mean, yeah, because I did that because that way I thought it would make sure that.
So it's good that it's on your driver's license. The reason I say that is I've had a few small agencies that have never made referral calls before in this year alone, and I've never done education there, that made referral calls and resulted in a donor. So I called them and thanked them for the referral call and then asked them what prompted it. They said, because I saw yes on your driver's license. So I highly encourage to make sure that you have that, because if they do pay attention to that, they didn't know what to do, so they called the local hospital and they walked them through it. So I do encourage that. I don't want to fear you that you won't be a donor out of the hospital, but I'm just telling you the facts right now. And that's another reason to be advocates for all of your family, right? So if something would happen to them outside the hospital, or they are a resident of a nursing home, or do go into hospice care, that you are being an advocate for them and that you're making sure somebody is making that call. And you shouldn't have to be thinking of that, but unfortunately, to make that happen, ask the paramedic. You could even call yourself if you had to. We'd rather have a couple phone calls than not. So again, be an advocate from a personal standpoint outside of a hospital setting. So like I said, those referral calls are increasing, but we'd like to see it more and more often. You are the link between a potential donor who can offer hope and the recipients who are waiting for a life-changing gift. Just again, remember that when you make that phone call, that is the linkage that's being formed there. A little bit about the donation process. I'll touch on organ donation so you guys can see kind of what that looks like. Even though you will not see that here in your hospital, I'll just touch on it and then I'll go deeper into the tissue referral process. In order for organ donation to occur, you have to be on ventilated care in a hospital setting. So that's first and foremost. So if someone passes away and is pronounced at the scene of a car accident, they're not going to be able to go on to be an organ donor, but they can still go on to be tissue donor. However, say they get in a bad car accident, they are ventilated at the scene or they're intubated at the scene, they're brought in the hospital and they're able to stabilize them and get them or try and treat them over time. Then we have the possibility of organ donation if they would not continue to get better. So at this point, they can either progress to brain death, and this would be 2 different doctors at 2 different times declaring brain death. The second doctor to declare brain death is legal time of death on their death certificate, and then we move forward with donation. That's here in Iowa. I don't think all states have 2 physicians declaring. Some only have 1, but we always do 2 just for that double check to make sure. And once someone then has been declared brain death, we have then met with the family, asked them for an informed consent to move forward with donation. If they decide to move forward, they would sign and date the paper. From the time they sign and date it, then we can start placing organs at that time. We cannot place anything prior to because we have not got the family's consent to do so. So with that being said, it could be another 24 to 72 hours if that patient is in the hospital before they go down to the OR for their organs to be recovered. Because if say 5 or 8 organs are being recovered, we're working with 5 to 8 different surgeons from 5 to 8 different hospitals, trying to get an OR set at the university or whatever, and then trying to find 5 to 8 different recipients. So there's a lot of work that goes into it. We do explain that to the families at the time. Some of them may not, they're dealing with such a tragedy that they may not even remember that, but we try and remind them of that. So we do have families that walk away because they just do not want to be 2 to 3 more days in the hospital. I get it. But I just like to explain that to people if you're ever in that situation, that that's what has to take place. Another way in which someone can be an organ donor is what we call death by circulatory criteria. So this would be those individuals that never get fully declared brain dead or can't because they're holding on to 1, maybe 2 stem cell reflexes. They still got a Glasgow coma scale of less than or equal to 5. So their injury has been told it's not survivable, they will not make it, but we can't fully declare them brain dead at this point. So they will still be given the choice if they decide to intubate at this time for organ donation to occur. So that's the 2 different ways in which that can happen. Donation possibilities. We've got the heart, lungs, liver, kidney, pancreas, and intestine that organs can be donated. We do have different viability stages for them all, meaning that we only have a certain amount of time from the time it's recovered out of the donor to get into the recipient. So again, timing is huge. A lot of our recipients, our chest is open waiting for that heart or lung to get to them. So it's also timing on the transplant surgeon side and the recovery surgeon side. So heart and lungs, we only have 4 to 6 hours. So by the time we get them out and into the recipient, we only have 4 to 6 hours to do so.
So where do they do that at? Well, like if they die here, I'm sure our surgery's not gonna harvest their organs. Where do they go?
Nope, so you wouldn't be able to do organ donation here. So organ donation would result at a higher level hospital. So if Mercy, North Iowa, the 2 hospitals in Waterloo do have donors. Your 2 hospitals in Cedar Rapids, your 2 hospitals in Iowa City, your 3 hospitals in Des Moines.
So we transport them there?
You guys transfer all critical care patients out, right? Yeah, so in a situation where they might be intubated, present in the ER, but they're critical care and the family wants more treatment, they would be transported out, and then if their candidate donation would occur at the hospital that they were transported to. Yep, you'll never see it here because you don't have ventilator
No,
care.
I know.
Yep, yep, so that's where it would happen at, is a higher level hospital that can support someone with a ventilator. So, good question there. So you may be in the role of stabilizing them prior to transport, so. As far as viability for liver, pancreas, and intestine, we have 12 to 16 hours, so we have a lot longer time frame there. And kidneys, we have up to 48 hours. We always try and place all of our organs locally, so meaning within the state of Iowa, at one of our 3 transplant centers or 4 transplant centers. If they can't be placed locally, then we start to move them outwards. So that's what we try and do first. It doesn't always happen, but we try, at least. On the other side, you'll see all the tissues that can be donated. There's quite a few tissues that people don't even realize. Our corneas are going to give the gift of sight. Our tendons are going to be used for such things like an ACL or MCL repair, maybe a meniscus repair, heart valves. I had explained those earlier about the pediatric kiddos. We use those a lot with them. Our veins, we take the saphenous and femoral vein out. A lot of times it can be used to create a fistula for kidney dialysis. I used to work in kidney dialysis, and the fistulas that were created with donor veins are a lot more effective than those artificial fistulas. They just flow a lot better, treatment seems to last a lot longer, the infection risk is a lot less, that sort of thing. Skin, breast reconstructive surgery, and burn victims are the 2 main things that we see skin grafting used for. And then bone, many different types of orthopedic surgeries, anywhere from small fragments of bone to larger bone. It just depends on what the surgery is that someone's having. And what's not on there is adipose tissue. We can donate adipose. We don't need very much at all. It's very rich in stem cells, so a lot of times they're going to use that and break it down into bone paste using orthopedic surgeons to help the regrowth and healing process. So what about your role in the tissue donation? Obviously, patient care comes first. Once someone does pass away, we like to see that phone call within an hour of that time of death if possible. We do understand you can get busy, take care of your other patients first, but if it's not a busy night or it's possible for someone else to make that phone call with you, it's better to call within an hour so we get the process started. There's a lot that has to be done. And then just support the patients and families' decisions. So just be supportive of them. Communicate anything with us. We're not bringing up donation to them. We're not talking about donation. But if they do bring it up, make sure you refer them on to us and don't try and answer any questions that you may not know the answer to. Because we just don't want to give anybody false hope or scare anybody. I don't even approach families, so I don't even know what conversation to have. So just don't even put yourself in an awkward situation. Like I said, if they do bring it up, just say, you know what, I'll just call Iowa Donor Network and let you talk to them. And that would be the easiest way to handle that. So the referral call, now that we have access to EMR, we don't necessarily have to keep you on the phone as long. We're going to ask some of the main questions that we always do up front. We may start to get more in depth if there's something that triggers us to ask more questions, but most of it we can look through the charts. Some things that we might ask for medical intervention right off the bat, we have to be able to account for every needle stick on somebody, especially in high-risk situations, to make sure that there was no IV drug use or something along those lines, again, that could contaminate that tissue. Next of kin is huge. We will always ask you on the phone, so please have that ready and available. And we may, if there's a couple people, it does not hurt to get a couple people's phone numbers, so that way